just remember that, because I had called him once to Cochin, and he gave a very good talk in the Indian Medical Association there. So the importance of spending time with the patient and creating leaflets. If you go to Natarajan's clinic, you will see a lot of patient education leaflets. We also, in our institution, we have a lot of patient education leaflets. And especially when you are dealing with complicated diseases. I mean, if you are just doing a routine general ophthalmology, it's okay, but especially when you are doing treating complicated diseases, I think it becomes even more important that you have patient education leaflets, and you must give it to them and ask the patient. If the patient can't see, that bystander has to read it in depth and understand the most important things. In our hospital, what we have done is some of the important things are highlighted there, so that the patient, for example, retina, it's highlighted that more than one surgery may be required, because these are things which are necessary, because in a retinal surgery, there is about 20% chance or a 15 to 20% chance that the patient may need one more procedure. And if this is not told to the patient earlier, the patient acceptability for this particular procedure may not be there at all. That happens in many institutions. That's how patients walk out from one doctor to go to the other doctor. You do a procedure, and after 1.5 months, you tell the patient, I need one more. You need one more. But then he has not been mentally prepared for that. So the moment you have told him, explained to him earlier, and said, look here, there's an 85% or 90% chance that with one procedure it will be okay, there's a 10% chance that you may need one more additional procedure later. So once you do that, the patient already is aware that yes, doctor has already told me that I may need one more procedure, and the patient acceptability is there, the motivation is there to do the procedure. Therefore, and in today, with all the medical legal problems, I think communication, in fact, most of the sessions that I held in medical legal practices, the most important thing that they are highlighting is that it's because of poor communication that this particular consumer case has come. So communication is the most important thing, where you need to explain. And when you get a problem, when you get a complication, it's very, very important for you to immediately explain to the patient. I think this is where the whole issue comes. You do a cataract surgery, you have a particular complication, and then we try to, hide it or try to delay the whole process of communicating to the patient, look here, you have a particular problem, and you need a particular procedure, etc., etc.
Malcolm Gallagher analyzed the cases in US, and he's found if you spend 15 minutes with the patient, and then other group of physicians will spend 18 minutes, they found that the consumer court case in the US have come down drastically. And the last question the patient asks is, surgeon asks is, do you have any more questions? And the patient says, I don't have any more.
So clear all the doubts of the patient, spend time with the patient, and patient education leaflets I think you can make. And patient education leaflets are very good because it's a scientific advertisement, because that just gives you the information as to what are the facilities that your institution has, what are the procedures that your organization has. So this is also a form of a small scientific advertisement, where by word of mouth you can spread the message. So this is something which I just saw this morning. This is an advertisement that has come in the Week magazine, and this man is another big man. This is Debashish Chatterjee. He is the principal or the director of one of the Indian Institute of Management. And the advertisement says, when was the last time you learned something for the first time? And it's really a very nice way of putting things. And this is what you were saying, innovation. Anyway, we'll come to that later. But the thing is that what he says is the leaders have to learn to aspire to imagine. And aspiration should be greater than resources. That is, always we need to have put our targets much more than what possibly we can. And then only we can achieve something. Complacency and living in what they call as a comfort zone. That's what happens to many of us at some point in our career. That we start living in our comfort zone. That look here, I'm already having this many patients. I'm already having this much, so there's nothing more to do. But unfortunately, in today's scenario, it doesn't really work. The moment we reach a comfort zone, we'll realize that in the next 1 to 2 years, our downfall starts. So it's very, very important for us to always keep moving forward. Always try to keep doing something different. Always, in fact, the session that Dr. Babu Rajendran started in the Tamil Nadu Ophthalmological Society many years ago, what did I do differently this year? That's a symposium. that he started. You know, each person talks for about 3 to 4 minutes on something that he did different, that he maybe something related to a particular surgical procedure or something, some change. That is, one person said he air conditioned his clinic. So, or made his clinic more modernized, starting EMR. You know, small clinics, small hospitals now can straight away go into total EMR or paperless systems. That's a new thing. I mean, therefore, there is a motivation. So, as and when, as things, something new happens in your organization or in your small setup, there is a motivation to work. Because once there is it's the same routine, you know, just like we get up in the morning and we sleep at night, that routine can't be changed. So, it's same thing when you go to the office, if the same routine continues, there is stagnation. And that's why many people leave organizations. Like Natarajan left Bombay Hospital because he knew that his ambitions cannot be fulfilled there. I worked for a hospital for 10 years and finally I said, no, I have to do something because I knew I had reached a total stagnation. And if I continue for another couple of years that way, professionally I'm gone. So this should never happen in your career, at least for the first 20 to 25 years of your career. And it is necessary, and that's why, and nowadays things are much easier because it's not like the good old license Raj. There are banks who are ready to finance projects, etc., much easier than what it was 10, 15 years ago. 20 years ago, it was so difficult to get a loan. The first loan I took from the bank, I paid an interest of 21.5%. You won't believe it. 21.5% in the license charge. For every 100 rupees that I borrowed, I paid 21 rupees back to the bank.
No, apart from that, I told them I paid for the first 25% of the, to get the loan, I paid 30% private loan.
Private loan. And the most important thing is those days, if you want 50 lakhs, he will say you bring something and put in the bank for 50 lakhs. Now where do you go for that? And the loan that I got from my hospital at that time, that manager was that it always happens. There's someone who becomes, it's your patient, he knows you're a, he told me, doctor, by giving money to you, I know I can serve the community. And he gave me a loan which was 3 times what I hypothecated to him. And he told me, look here, the bank is going to send me a nasty letter. And that's what happened. The main office of the bank sent him a nasty letter saying, I mean, if you read it, it appears that he has taken bribe from me to give that particular loan. So that was a license Raj when things were so difficult in our country. But today things are far easier and it's very easy for us to get these finances for new projects, for updating our clinic, our facilities, etc. So leadership is a capacity and will to pursue a particular goal that you have set for yourself. And leadership is a process, as you have rightly said, it's a process. It's not achieved within a day or two, it's a process. It takes many years. And basically, we have to set our goal. And the most important thing, like Natarajan said, is we need to analyze our strengths. Very often what happens in our profession is that in a competition, we try to copy our competitor. See, that's very much happens. It's like, you know, one of the suppliers of a particular equipment, he came and told me, doctor, your neighbor has purchased it. I said, a neighbor may purchase a Mercedes. That doesn't mean that I have to purchase one tomorrow. So that's what happens. So you have to analyze what are your strengths. Like in our institution, our strength is we are vitreoretina department. And it is our, the philosophy of our institution is that we cannot sacrifice the investments in the vitreoretina department for the sake of developing other departments in the institution. So the thing is that just because, you know, Vasan comes, he starts LASIK. Now that doesn't mean that tomorrow you have to start LASIK, basically, because even without that LASIK, you're going to get your patients. But you improve on whatever strengths you have, so you improve the facilities that you have in your particular area, because that's more important. So 70 to 75% of your time, you should really sacrifice to improve your strengths. And that way, you can grow. So never be carried away by your competitors. Never try to copy others so as to grow, because these are all short-term benefits. But long-term, finally you realize that whatever your strengths were, they are getting weak. And that's where, and you start losing patience, because you're not built up on what you're already built. So you need to strengthen what you have rather than diversify too fast. And that's why I always feel that these sort of corporate institutions where they start 200 branches, 250 branches, is okay for brand. But I'm sure that at any point of time, at least 20 to 25%, it's what happens. Even the supermarkets, for example, Spencer's,